informative, and through that she spreads knowledge and awareness of dental hygiene and other oral cancer and other preventative methods for the same. Today she is here between us to tell us about brushing techniques, how brushing is different for every age groups. Brushing is different for young people or old people. And then she's going to speak about why do you need to get your teeth fixed. For example, if you have your cavity, why do you need to see your dentist right away? So she's going to speak about all of these topics. And we have received the questions which all of you have shared with us, and we have shared the same with Dr. Huma, to which we will answer at the end of the session. So yes, Dr. Huma, this is all to you.
So hello everybody, it's really nice seeing all of you on the screen. And I think I'm seeing so many people at once without masks after a long time. So yeah, I'm feeling very happy and excited to start the session. So yeah, I think we can, and thank you, Dr. Prachi, for giving me such a beautiful introduction. So I think we'll start with the session, and if you have any doubts, then you can just raise it to me at the end.
You can't see, doctor.
Oh, just a second, I'm just on it. So can you see it now?
Yes, we can see it.
Yeah, okay. So let's get started. Firstly, why oral hygiene is important. Now, our oral hygiene is directly connected to our overall health. Now, can you hear me?
Yes, let's request all of members to kindly mute your mic so that you all can all listen to Dr. Huma.
Okay, so as I was saying, our oral health is directly connected to our systemic health, and a dentist can look into your mouth and say that if you have early diabetes, or if you have had diabetes, or if you have had hypertension, and what are your eating habits. So all of this reflect in your oral cavity. So it's very important that you keep your oral cavity clean and healthy so that you can maintain your lifestyle as well. So how do we maintain our oral hygiene is, firstly, we need to brush twice daily. Now, many of us have the habit of brushing only once in a day. So we brush early in the morning. So there's a saying called, if you want to keep your friends, brush in the morning. And if you want to keep your teeth, then brush at night. So, it's very important that you brush at night as well, because for 12 hours, whatever dinner you have, it's going to stick on your teeth and stay there for 12 hours. That is when majorly the bacteria come and attack your teeth, because they can consume on all the little bits of food that is stuck in your mouth. So it's very important to brush in the morning as well as in the night. Now, second is that you rinse after a meal. Now, most of us, what we do is we don't like to drink water immediately after our breakfast or lunch, right? Because we always say that we need to keep a 30-minute time span between having your food and immediately drinking water. So in such cases, what you need to do is rinse your mouth, because whatever small sugars or starch which gets stuck in between your teeth, that can lead to cavities. So it's always important, and it also leads to like gum infection, right? So it's very important that you rinse your mouth after every meal. And the third thing is to stay hydrated. Now, staying hydrated helps your gums. It helps you, when you drink water frequently, like say every 1 hour, it is cleaning your oral cavity. So that is how it keeps, helps maintaining your oral health and hygiene. Now, I get this question so many times. Every patient that comes to my clinic, the first question will be, what toothbrush do I use? So that is the most common question that I get. Now, when it comes to toothbrush, it's very important that you use only one type of toothbrush. You should not keep switching between your toothbrush every month, or say every 15 days. It's only once in 6 months that you should be changing your toothbrush. Now, what happens when you change your toothbrush is the bristles of that toothbrush are very hard initially, and then slowly they tend to soften, right? So every time when you change your toothbrush every 15 days or every 1 month, what happens is the harsh bristles damage your gum, and the enamel surface of your tooth. So it's very important that you change your brush only once in 6 months. Now these toothbrushes that we get, they are of three types. One is the hard one is the medium bristles one, and one is the soft or gentle one, which is for sensitive teeth. Now among all this, which one should a person use? A hard bristled brush is not recommended to anybody. But the medium bristled brush, that is the one which all of us should be using. And a gentle one is advised for people who have like very much of gum recession. So if you have like gum recession or issues with your gums, it's very important that you visit your dentist and show your oral cavity to them, and then ask them that what type of brush you should be using. Now, who should use an electric toothbrush? Now, for example, if you are suffering from a disease, or if your muscles are kind of weak, and or if you are not conscious of how many minutes you're brushing, like it's advised to brush 3 minutes. So in that case, you can take a electric brush. Now, what this electric brush does is it beeps for every quadrant. So it makes sure that you are cleaning your teeth efficiently for the given minutes of time that is required. And one more thing with this electric brush is you don't have to clean your teeth. It cleans your teeth for you. So you just have to hold it in front of your teeth and it starts cleaning it. It's having that vibration in the bristles, which cleans the teeth, and it applies the adequate amount of pressure. So you don't have to, worry much. And the third thing is you should use an interdental brush. Now, uh, let me just use a marker. Now, this is an interdental brush. Now, most of us, we have undergone root canal treatments and we have caps, right? So when there is a cap and when there is a natural tooth adjacent to it, naturally what happens is food gets stuck in between. Now, usually what people tend to do is pick a toothpick, and they take that sharp toothpick and they try to remove that whatever is stuck in between the teeth out. But what happens is that actually that pointed sharp wooden pick actually damages the gum tissue, and it actually helps resorption of the bone. So what you need to do is do not use sharp wooden toothpicks. Instead, you can use an interdental brush. Now, how to use this brush is you can soak this brush in water, and you can just gently take it and put it in between your teeth wherever the food gets stuck between the metal crown and the normal tooth, and gently clean it out. Now, one more thing very important is using a toothbrush cap. Now, basically, if there are 5 to 6 members living in one house, what we tend to do is keep all the brushes in the same container, right? So what happens is those bristles, they touch each other. And that is how bacteria travel from one person's mouth to another person's mouth. And that is something that nobody wants. So one more thing about capping your brushes, you should not cap a wet brush. Then what happens is the bacteria keep building up in the same cap. So you need to dry your brush and then put it in a cap. So after brushing, you can keep it for outside for 1 hour and then cap it. And yeah, one more thing is make sure that you also clean your last tooth. Now, what happens when we generally brush is we tend to clean all our teeth, but the bristles of the brush, they don't reach the extreme last tooth, and the last tooth start decaying. So how you generally have to brush your last tooth is, now I have a model with me over here. I hope you can see. So this brush, it will not be able to reach the end, because when you're opening your mouth wider, this brush cannot reach till the end. So you need to close your mouth a little bit and then push this brush inside and then brush your teeth, which are extremely on the back. Now, how to take care of your toothbrush? This is very important, especially if you have, or now because of COVID, as soon as a person recovers from COVID, we make sure that we sanitize our rooms, sanitize our homes, sanitize our doorknobs, make sure that we wash our hands frequently, but we forget to replace our toothbrush. So you're using the same toothbrush when you were, affected with corona or COVID positive, and you're continuing using the same toothbrush, then that's not fair. So what you need to do immediately after you have had a cold or fever or any infection, which is, even though it is not an oral infection, it's a systemic infection, you still need to change your toothbrush. Um, yeah, and what other thing what you can do is, hydrogen peroxide 1%. You can dissolve it in a cup of water, just a small amount of 1 ml of hydrogen peroxide in water, and then you can dip your brush in it so that all the bacteria die. And then you can clean it with, you should make sure that you clean your brush at least for 30 seconds under running tap water before you put it in your mouth. And yeah, you need to replace your toothbrush as soon as its bristles start to look a little rough or disorganized. And yeah, if before 6 months, if your brush is looking like this, then you're brushing way too hard. So that is not recommended as well. You need to make sure that you're brushing softly. And one more thing is, most of us tend to keep our toothbrush in the bathroom, which is in association with the toilet. Now, whenever you flush a toilet, the germs from the toilet tend to travel to up to 6 feet. So there are literally particles from the commode that are traveling through air and settling on your toothbrush. So please make sure you don't keep your toothbrush in the same place where your toilet is situated. The next question that I get asked very frequently is what toothpaste to use. Now, this is a very interesting answer because all the basic toothpaste that you get, be it Colgate, be it Pepsodent, they have the same base. So whichever toothpaste you're using, whichever company toothpaste you're using, that doesn't matter. But I suggest everybody to use a normal basic toothpaste, like for example the Colgate cavity protection that you get, which has fluoride in it. Because fluoride, what it does is it prevents cavity preparation. You don't need salt in your namak, you don't salt or namak in your toothpaste, you don't need neem in your toothpaste, you don't even need clove oil in your toothpaste. All of that is not required. Just the basic one is the best one to go. And especially, like, now they release this whitening toothpaste and people are like, oh, I want white teeth, and then they start using whitening toothpaste and then they get sensitivity and then they switch to a Sensodyne or a sensitive toothpaste. So all of that is not required. Just use the basic toothpaste and stick to one toothpaste, because different toothpaste have different abrasives. So when you switch from one toothpaste to another, it's not required. Just stick to one toothpaste and use that. That's it. And one more thing, yeah. How does your toothpaste look like? 1, 2, 3, 4. You can unmute and answer if you want to.
फोर वाला इस तरह से करना चाहिए करके ना सब लोग ऐसे
Four.
Oh yeah, right. So we are supposed to use our toothpaste like this. That is because, when you roll it from the bottom, it uniformly distributes and comes in a uniform way, like all the abrasives and all of it. So make sure that you roll the tube upwards and not any other way. The next important thing is floss, which most of us don't do, but is very important because, the surfaces of the tooth which are in between, like in contact, that is 33%. So basically, when you brush and rinse and everything, you're leaving behind 33% of your tooth surface without cleaning it. And just imagine not cleaning that 33% of the teeth, since so many years. So I have a floss here and I'll show you how one should be flossing. I think I have a video for that. Yeah, let's just follow the video. Okay, let me just demonstrate. So this is the Colgate floss. Now what you need to do is take a good amount of it. Then you have a cutter here. Now what you need to do is roll it around your finger like this, and again on the other side. And then this is your teeth, right? Now let me just hold the upper one.
Excuse me, doctor, we can't see your demo.
Okay. Do you want me to show that again?
We can't see your picture. We can't see the demo. We can only see.
Dr. Huma, what you can do is you can stop sharing your screen right now so that you as
Okay.
a speaker will be bigger on the screen for them.
Okay.
They'll be able to see you.
We're only seeing Johnson & Johnson's reach.
Okay, do you see me now?
Oh,
No, I think you'll have to stop sharing because right now that is occupying the major part. Okay.
Okay.
Request everyone else to go on mute so that you all will see Dr. Huma. in a bigger
So
picture.
yeah, now is it better?
Yes, now we can see you.
Okay. So okay, can you see this? So this is basically the floss that I took. This is the floss, and you need to take a good amount of string in your hand. You can cut it like this. This is the Colgate one that I use. It's very handy. And then you need to roll it on one of your finger like this, and the same in the other hand. So you see I have 2 loops on each of my fingers. And then now this is your teeth, right? So yeah.
we can't see you at all.
Okay.
Even
we
the,
can see it clearly.
miniature version of the picture is not visible to us.
Sir, we can see it clearly.
Can you see it now?
Yes, now
It's small. Yeah. Okay. Can you enlarge this?
Mr. Kenneth, you'll have to change your view on the Zoom to a speaker view. On the top right corner, there's a speaker view. If you select that, then Dr. Huma's picture will be big on your screen.
It's on speaker view only.
Okay, so everyone else, if they are muted, then her screen will be big on your phone.
Yeah.
Okay, so this is how you need to get in between 2 of the teeth and then make a C around the teeth. Okay, like this. Okay, and then you need to gently go down like this. And similarly, you need to do it on the other side also.
Nothing.
Make a C like this, pull from each side, and then put it down. So you need to repeat, in the beginning, it's very difficult to floss because when you're getting used to it, it's a little difficult. But once you get a hang of it, it's very easy. And you might feel like, oh, I don't need flossing because my teeth are healthy and all that. But literally when you use this floss in between your teeth and then you get it off, you can see all that dirt on the floss. So even after you brush, rinse, do the mouthwash, if you're flossing, you can see that dirt come out on the floss. So please try it once in the beginning. It's a little, difficult and you might feel like it's time consuming, but you will get used to it. So please make sure that you try it for at least a week before, giving up on it. So I'll share my screen again.
Don't worry, for all those who didn't see it properly, we'll share the recording with you all on the group so that you all can go over it, all right? Yes, Doctor, we can see the
Okay.
screen now.
End में अच्छा अच्छा अच्छा
Can you see my presentation?
Yes, we can.
For some reason. Just a second.
Hello,
Yeah.
Dr.
Right.
Hi, Huma. Sorry. We are having questions from Mrs. Vaz and Gopal, Mr. Gopal Anand. When
Okay.
the caps come out.
Pardon? What if the gaps come out? Okay. So for that, firstly, for people who have caps, there is something else that I want to add to this. That is, you can use a water flosser instead of using a interdental floss. Now also, instead of using floss in the areas between the crown, you can replace it with an interdental brush. So wherever previously the brushes that I showed, right, which were the interdental brushes, you can use that in places of where you have a crown placed, and otherwise you can use a floss. And I'll be talking about the water flosser also, which is very good in case you have a prosthesis in your mouth. Okay, is there any other question?
No.
Hello, how often flossing should be done?
It should be done at twice a day, just as that of brushing. Every night. If you miss it in the morning, it's okay, but at night, it's very important that you floss.
Okay, thank you.
Doctor,
Yes.
does Jogron syndrome affect the teeth?
Yes, it does. Now, Sjogren syndrome is something called as, majorly in the mouth, it is called as dryness of the mouth. Okay, Sjogren syndrome causes xerostomia. Xerostomia is dryness of the mouth. So when the mouth is dry, what happens is, it is more prone to cavities because our saliva, it maintains the pH. It decreases the acidity level in our mouth, because of which there are no cavities. Okay.
Okay.
So for Sjogren syndrome, what you can do is, again, you can visit your dentist and he will prescribe you a tablet which is called as a Silolog. Now, what happens with the Silolog is when you place it in your mouth, it helps you release that saliva. So that again helps you decrease cavities. So in case you have Sjogren syndrome or somebody has Sjogren syndrome, a Silolog is advisable, and you can visit your dentist and he'll prescribe you one.
Okay. Thank you, doctor.
Okay, so moving ahead, a mouthwash. Now, using a mouthwash is important because, again, all the gaps and everything, it cleans overall. But again, one more thing is, don't use a mouthwash which has chlorhexidine in it. Okay, what chlorhexidine does, it stains your teeth. So it's very important that you first visit your dentist, and or whenever you go for a general checkup, you can ask him or her about what kind of mouthwash you're supposed to be using, and he will prescribe you one. And also, just don't go to a medical store and pick up a mouthwash with chlorhexidine, because it tends to stain the teeth, which is not good. Now, coming to the brushing technique. Okay, coming to the brushing technique, I will demonstrate it to you because I don't think the video is working. So I think I should stop sharing my screen then. Yeah, so let me demonstrate. Now, these are your set of teeth and this is the brush. So what you're supposed to do is hold your brush like how you hold a pen. Okay, and place it at a 45-degree angle like this. Okay, and then what you're supposed to do is brush in circular motion and then downwards. Okay, okay, now you can see probably in circular motions and away from the gum like this. So what happens is you don't get any gum recession. Usually in adults, there is gum recession seen, like all of this tooth, the bone over here is exposed. The root of the tooth is exposed. So you can do in circular motions and go down like this. So this is how you can brush your upper teeth. When it comes to the lower tooth, you have to follow the same technique, but instead of going below, you need to go up again, opposite direction to that of the gum. Okay, and yeah, and also don't forget to brush the top of your teeth, which is straight like this. And make sure when you're brushing your last tooth, close your mouth instead of opening your mouth like and then getting it. Just close your mouth a little bit, and then brush the back of your teeth. And on the lingual side, what you're supposed to do is again the same. Do round circles and up. Also on the lingual surface. Now, when it comes to the anteriors, which is the front teeth, you can use the tip of the toothbrush and do this and clean the back side of your lower teeth. Similarly, with the upper one, make sure that you clean with the tip of the toothbrush in the anteriors, and make sure that you brush on the lingual side as well. So that's how you're supposed to brush your teeth. And don't forget to clean your tongue as well, because most of the problems like malodor, which is smelly breath, that is because of not keeping your tongue clean. So make sure that you keep your tongue clean as well. Okay, going back to the presentation. Yeah, and now there's something called as scaling or professional cleaning, which a dentist can do in a dental clinic. And I'll tell you why it is important. Now, can you see? Yeah, this that you see over here, this calculus like deposition, this is called as calculus, or it's called as starter in basic language. So this is what happens when food gets stuck in between your teeth and you don't brush properly, and it gets calcified and it gets stuck. Now this thing that is stuck, it cannot be removed by normal brushing of your teeth. Now if you happen to see in a mirror and see this on the, especially on the lower behind the lower anteriors, that is the lower teeth, it's usually over here. So if you happen to see in a mirror and find out that you have this, it's better that you get this clean, because it's not going to come out with a toothbrush. Now what your dentist will do is he'll use an ultrasonic tip, which is having a water jet, and he will carefully go in between the teeth and the gum over here and clean the starter out. Now, why it is important to remove this is because it directly affects your bone health. Now, your gums over here, you can see this is the after treatment, after removal of the calculus or tartar. So what happens is, once you remove this calculus, bone formation or healthy tissue formation, that is healthy gum formation, occurs in this area. So if you don't remove this calculus keeps building, 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 and the bone health there is poorly, is very poor, and then your teeth start shaking. So it's very important that you get this cleaned. And one more thing is, people have a lot of misconception that once you get a professional cleaning done, your teeth will start shaking. But that is not at all true. Because what happens is, once you remove this, right, you feel like there's a gap in between your teeth. This gap is what you feel. So people think that their teeth are shaking, but that's just a feeling that you'll have for 1 or 2 days, and then bone formation will hopefully occur here, and then you'll have healthier teeth and gums. So it's very important that you go for scaling. One more important thing is, when you go for a regular scaling twice in a year, actually 6 months, once in 6 months, your dentist will have a clear view of your entire mouth. So if there is any caries, small caries that is starting, or small decay which is starting, or any small issue, then it will be resolved directly. So you don't have to wait till the problem is major, till you have pain, and then you have to go for a root canal. So when the problem is so small, you can identify it when you go for every checkup every 6 months. Now, one more thing is sensitive teeth. So most of them have sensitive teeth, and immediately when a person has sensitive teeth, instead of going to a doctor, what they directly do is they go to a medical store and they buy a sensitivity toothpaste, and they start using it. Now the problem with that is, your sensitivity will definitely be resolved with the toothpaste, but the cause why that sensitivity came in the first place, that cause will not be treated. So that cause will be underneath, growing, still keep on growing, but you'll be using a sensitivity toothbrush, so you'll not have any sensitivity. So your body is trying to tell you that there's a problem, but then you don't see it. You just suppress the body's reaction, so you'll not know what problem has caused this sensitive teeth. So again, it's very important, if you have sensitive teeth, first rule out the problem which caused the sensitive teeth. Don't directly go for a sensitivity toothpaste. again, sensitivity can be due to vigorous brushing. It can be due to a small dental decay. So the treatments for all of that are very simple, right? Once the problem goes to pain, then that's the end game for teeth. I mean, you have to go for a root canal and the tooth will be dead. Now coming to dental treatments and dental processes. See, this is when you'll have sensitivity. When you see this tiny pits or tiny black dots, this is when you'll have sensitivity when you drink cold water or hot water. Now the treatment for this will be as simple as using a composite filling. So this is a tooth colored composite filling, and you can barely make out that there was any problem, and this will cost you way less than what a root canal costs. So when the cavity goes deep or big like this, then you'll have get pain, and once you have pain, it generally means that the decay has reached the root. This is the root of your tooth, and this is the pulp, which is the life part of the tooth. So this contains all the blood vessels and all the nerves, which keeps the tooth alive. So once the decay enters, from top it might look very small, but again inside it might be very big. So once it reaches the pulp, you'll get all this infection. This is called as a periapical abscess. So once you have this, the only treatment is root canal. So what we do in a root canal is we remove all this dead tissue from here, and we replace it with a filling, and the filling is usually gutta percha, and then we close it, and then we prepare the tooth, and then we place a crown. So this treatment costs a lot, and this treatment costs very less. I mean, also that, and also, we cannot replace the natural looking tooth with a live tooth. You can't replace a live tooth with a live tooth. You have to replace it with a crown or a prosthesis. So it's better that you save your tooth instead of placing a crown. Now replacing missing tooth. I'm not sure why I'm not able to play the videos. Yeah, okay. So I'll show you a cast right here. See, you can see that there are missing teeth over here, and this part had missing teeth which we have replaced. This is called a bridge, and it looks exactly like your teeth. Nobody will even be able to make out that your teeth have been replaced. So this is a very efficient way of replacing your tooth once your teeth is already lost. If you can save a tooth, you save a tooth, but when you can't save a tooth, we also have treatments for that. And why we need to replace a tooth is because, see, what happens is, I'll show you over here. Yeah. What happens is when you lose your bottom teeth, the teeth from your top tend to move downwards. So what happens is the root over here for the upper teeth is replaced, and then the tooth in front has no support in the back. So again, it will try to bend in either of the direction. So what happens, it affects your upper teeth as well, and it affects the teeth in front of it as well. So once a tooth has been extracted, unfortunately, if it is extracted, then it is important that you replace it. And one more important thing is the back teeth. They are very important for chewing. So if you're chewing only from one side, again, it's a problem. You'll have some sort of issues like with your muscles, you'll have some pain. So it's very important that, once the tooth structure over here is lost, just replace it so that you can eat from both sides. Now, one more problem is bruxism. Now, bruxism is also called as night grinding. So when you're sleeping at night, subconsciously, you're not aware of it, but your teeth are kind of grinding against each other. Now, I'll show you an example. Now, these are normal teeth, okay? They have a well-defined edge. Now, you can see over here in this cast, all these teeth are like ground. You can see one straight, sharp edge. Now, this is what happens when you have bruxism. Can you appreciate the difference? So that is what bruxism is. So now for bruxism, Bruxism, again, there's a thing called as clear aligners. Let me show, sorry, not clear aligners. It's a night guard, excuse me. So this is how it looks. It's very transparent. And you can wear it when you go to sleep. And, whenever you try to grind your teeth, it protects your teeth from that grinding. So it's very useful, very convenient. So if you have the habit of bruxism, if you wake up with pain in your jaw immediately after waking up, then you might have bruxism. Or if you, when you're sleeping next to your partner, if you can hear that crackling noise in the night, that means that they have bruxism. So you can just consult your dentist once, and then you can get this night guard done. And yeah, it's very useful that way. Also, this when your teeth are abraded like this, you'll have a lot of sensitivity. So a night guard is very useful. Now, next thing is the dentures. Now, when all the teeth are missing, that is, or some of the teeth are missing, then you can go for a removable or a fixed denture. Now, of course, with fixed denture, you'll have fewer problems, but with removable one, most of them take time to get accustomed to it. But nowadays we have different types of dentures, like you have the flexible ones, which are like, a rubber base. So they bend like this and they go in your mouth, and then they spread to take their position in the oral cavity. So they are really good and easy to get adjusted to. And they look very similar to your teeth. They reflect the color of your lips and like the underlying gums. So yeah, and also like they give you, they give you a little more confidence. So dentures are again very good options for replacing all your missing teeth. Now, how do you get adjusted or take care of your dentures is very important. First thing is, if you want to make them last longer, you don't have to, you should never soak it in hot water, because they are made up of acrylic or medical grade silicone, if they are elastic ones. So what you, if you soak it in hot water, then they shrink, or they become elastic, so they'll not fit you properly. And do not use any sort of and if you accidentally damage your dentures, do not try to fix them or paste them directly. And if you are having the habit of playing sports, then make sure that you're not wearing dentures when you do that, and refrain from tobacco use. Now, how to keep your dentures clean is daily after every meal, you're supposed to make sure that you clean your dentures. And then you can use warm water, soap, and denture brush to clean your dentures. And you always make sure that you clean the leftover denture glue if you are using a glue to fit it. And next is always soak them in water when you go to bed, in a glass of water. And when you need to see most of the times what happens is, you get a denture, you have a problem with it, so you stop using it, or you don't what you need to do is, the right thing to do is, you need to visit your dentist. So if there are some small adjustments, he'll do it, so that will be easier for you to use. And if the dentures get broken, of course you need to visit a dentist, then he will tell you if that can be repaired or if you need to get a new ones. And if you have any mouth sores because of wearing dentures, even then you need to visit your dentist. And in general, make sure that you visit at least 3 months after you get your denture, and then every 6 months, because if there is something wrong with your denture which you have not noticed, which your dentist might notice and fix it for you. Also, diet for dentures is, make sure that you cut your fruits or vegetables, raw vegetables, which I really recommend eating, into small bits and pieces before you, instead of eating the whole. And I suggest that not only for people with dentures, I suggest that for everybody. Make sure you cut your fruits and vegetables before you eat them. And the second is, be mindful while eating hard food. If you're eating things like peanuts or almonds or cashews, make sure that they are soaked overnight, so that they're not as hard. Then make sure you use sugar-free and denture-safe sweets and gums. And yeah, you eat all different types of food. Now I'll talk about it in the next slide. And also avoid eating fried food or fatty meats, biscuits, cakes, sweets, and drinks. Now, it's very important to maintain a very healthy lifestyle. So, what happens when you don't have a proper set of teeth, when you don't have a proper oral equilibrium? What happens is it directly affects your diet. Now, when you're not eating good food, it directly affects your overall health, right? So it's very important that you maintain your overall oral hygiene. And it directly, now all the food that you eat directly impacts the health of your gums as well. So make sure you eat all the green leafy vegetables, all the fruits, and all the whole grains. Now, let me just say in brief about all of this. This is beta carotene, which is very rich in orange looking food. Now, beta carotene is a vitamin A precursor, and it is very good. Like all these foods are cancer preventive food items, and they also help you maintain a very good health. Now we know vitamin A is very good for your eyes. And then we have retinol. Retinol is all the dairy products. Now, whatever food I'm telling you to eat is for people in general good health. Now, if you have something that your doctor has advised, like people who have some kidney disorders, the doctors will usually advise them not to take tomatoes, or some people are advised not to take dairy products. So suggest you all to follow the diet which is given personalized to you by your doctors. And this is something that I'm talking in general. Please do not take it like, okay, Dr. Huma had told me to eat and drink milk and eat tomatoes, so I'm going to eat them for dinner today. No, if your doctor has advised you not to take something, please make sure that you stick to your personalized diet. Okay. And so coming to tomatoes, we have lycopene, which is present in red fruits and vegetables, and it is very good when it comes to antioxidants. Next is alpha tocopherol. Now this is vitamin E. It's present in margarine, it's present in olive oil, and it is present in green leafy vegetables. Then we have mushrooms. They have very, refined bioactive components. And nowadays, mushrooms are available mostly to everybody. It is accessible, so you can try mushrooms. And then we have curcumin, haldi. Most of us include it in our diet. Though you need to eat haldi in a very small quantities, because again it will stain your teeth, and then you might have yellowing of your teeth. So if you're eating something with haldi, make sure that you rinse your mouth. Next, we have spirulina. This has a lot of antioxidants, phytochemicals, and you usually get this in the form of tablets as well. And we also have ascorbic acid, which is present in all citrusy fruits and vegetables like lime, and we have oranges. And one more thing about ascorbic acid or acidic fruits is, once you take a glass of lime water or orange juice, make sure that you rinse your mouth, because the acid content in this is quite a lot, right? So you don't want that to damage your enamel. So whenever you're taking any food which is acidic, make sure that you rinse your mouth. And green tea is also very good for your health, and neem is also very good for your health. And according to me, what you should be avoiding is saturated fats, or fats which are derived from animals. And next is salted meat. And we marinate this meat with salt and chili and keep it overnight and fry it the next day. That is very unhealthy, so try avoiding that. And processed foods like salami and sausages, we should try to be avoiding that, especially from the burgers and all of that. And smoking and alcohol, of course. And dairy is something that you should consume in a very limited amount. So make sure that you don't consume more of dairy, because it contains a lot of fats and a lot of things which cause ill effects on your health. I would also like to say, let your medicine be your food and your food be your medicine. So coming to the Q&A part, I have a few questions which were already asked. So let me answer the first question, which was, what should we do to maintain dental and gum health as we age? What do you do for bleeding gums and bad odor? Now, first question is how you maintain your dental and oral health. Is first thing you need to maintain a very good oral hygiene. So make sure you're brushing in the right way, and make sure you're using the right aids to brush your teeth, and make sure that you're doing it twice. And gum health, it's very important that you eat the right kind of food. Make sure that your food has it's balanced. Make sure that you have vitamin C in it. And if you have bleeding gums and bad odor, now bleeding gums you have when you have vitamin deficiency, or there may be some inflammation in the gums. So make sure that you check with your dentist, or if there is any inflammation, make sure you get it checked and corrected. Now, reasons for bad odor, it can be because you have forgotten to clean your tongue when you're brushing. And secondly, it could be because of a decaying tooth. So if you have a decaying tooth, or something that is something that needs attention, so make sure you correct the problems, so that these are the reactions of the body which automatically get corrected once the problem is sorted. And the second question is, my 3 caps have come out in the lockdown and you cannot fix it back because they keep falling. As a result, the person is eating soft food with my front teeth and getting scraped off. What to do? So yeah, our front teeth are not made for chewing. They are made only for cutting. So what you have to do is, if you go to a dentist, they will use a cement to fix your tooth back. If you just position your tooth back by yourself, the problem is not going to solve. There's a cement called as glass animal cement, which the dentist will use to place your cap back into position. And after that, hopefully you'll be able to keep using your caps again. And if those cap is not fitting you properly, then there'll be an alternative prosthesis that, or a new prosthesis that can be provided to you, so that you can get comfortable using with that. Now, third question is, what toothpaste and brush should I use? I have already answered this question. So don't use namak wala or neem wala toothpaste and toothbrush. Use a normal toothpaste and a normal toothbrush, preferably the one which has fluoride in it. And how do I brush my inner teeth? Yeah, I have answered this as well. So use the tip of your toothbrush and position it like this, and you've got to clean it like this, in upward motion like this. Now, how do I use a water jet for cleaning the gaps between my teeth and gums? Which company and its model is good? What procedures can one take while using it? I shall be very thankful to the dentist if. Okay, I cannot give you a practical demonstration right now, but what I can do is I can share a video with Khyaal and they can forward it to you. And I basically use a water flosser which is from Aura Cura. It is called OC200. So it comes with 2 different tips. So what you need to basically do is, so it comes with a tip, right? You need to position the tip in between the teeth. And I like to use it in the mode called pulse. So there are 4 or 5 different modes, right? You can select the pulse mode. And if you position it in between your gums, then it will slowly put water in between the gaps and clean. And now this is very good if you are having problems with flossing and if you have a dental prosthesis. So yeah, so that is very good. And I think I'll share the link with Khyaal as well. If you use my link, you might get a 10% discount. Yeah.
Thank
So
you.
you can use that. No problem.
Okay.
So yeah.
Please continue.
Yeah, if there is any more questions, then I think we can take that now.
Doctor, what is the model number of Aura Cura, you said?
I think it's OC200. So there's OC200 and there's also the next model. So OC200, it has a small, I think I might have a picture. It has a small container in which the water gets filled, and it comes with 2 tips, so 2 people can use it. Yeah, I think that's that.
We have one more question, which is Vaz. She's saying flossing usually causes gaps in my teeth.
Okay. So, okay. most of them have this misconception, and it might be because you are okay. So just imagine if this is both your teeth, and then something is stuck in between this teeth. Now you feel like there is a type of tightness because of the thing that is stuck in between. Now, when you remove that dirt from there, you feel like something new, and you feel like your tooth have loosened, but that's not the case. It's just because that particle is out from between your tooth, there is more gap in your mouth, and that is why you feel like there's a new gap that is created, but it was a gap which was filled with something and you just removed the dirt out.
Okay.
Ma'am, 1 second, ma'am. My granddaughter, she's just 8 years old, but she has started getting cavities in her teeth, and a little bit of gap are also coming in her teeth. So what should I do for that?
Okay, for 8-year-old, it's normal to have gap in between your teeth, because what happens is as we grow, our body grows, our face grows, but our teeth don't grow. They are the same size, right? So when a baby tooth is lost and the next tooth is coming, what happens is there are some gaps because the bones are growing and the baby teeth are small, right? So it's just a natural way of the body to make space for the permanent teeth which is going to erupt, which is going to be bigger. And second thing, why she's having cavities is, uh, I need to get into the history. If she's using a bottle for feeding, that is milk, why, before going to bed, if she's have had milk, then make sure that she rinses her mouth. Make sure she's brushing twice a day, and make sure that in between the night she's not holding that bottle in her mouth and sleeping overnight. So that could also be the reason. So make sure that you check all these reasons out.
And grinding is, they also do grinding when they're sleeping. Like my grandchildren, they are grinding their teeth when they're sleeping.
So in that case, it's better that consult the, like, when they start getting their permanent teeth, the permanent teeth are new, right, in the oral cavity. So they're not adjusted to the environment, which is kind of harsh in the oral cavity. So just make sure that you visit the dentist and ask the dentist if they need a night guard, so that it's a little difficult when their teeth are falling and coming and all of that, but make sure you visit a dentist and keep a check on that.
Thank you, ma'am.
No problem.
We have a couple of more questions.
Sure.
How do you remove your teeth which is stained by consuming apple cider? How do you change the texture?
Okay, so what you can do is, if there are stains, we can definitely get it off. The stains which are external to your teeth, which you have not had since birth, can definitely be taken care of. So you can definitely go for a scaling and polishing, and that will remove all the stains. And if you still have problem with the appearance, then you can go for teeth whitening. In office teeth whitening, please do not use tooth whitening toothpaste at home, because it will cause irritation to your tongue, it will cause irritation to your gums, you'll have a lot of sensitivity. So don't go through all that. Just go for a relaxed 45-minute session at your dentist and he will whiten your teeth.
Amazing. Moving forward, I wear a night guard. Are there ways to slowly get rid of this habit?
Okay, so if you're wearing a night guard, okay, there are two things. Firstly, a night guard is usually given for 1 to 2 years, so that your muscles, get habituated to the new position of your teeth, so that they're relaxed when you sleep. So if you have been using it for quite some time now, visit your dentist and then ask him if you can stop using it, and then you can stop using it. So that's how that treatment goes. So it's not like something you might have to wear it forever, or in some cases your muscles might have actually got adjusted to the new position and you might have to not continue using it. So make sure that you get a personalized view about it.
It's very bio-individual.
Yeah, pardon me?
It is very bio-individual.
Yeah, it is bio-individual. It is.
Okay. There is one more question, which says, usually dentists ask you to remove your wisdom teeth. How do you take care of it much before to avoid this?
Okay, so most of the time what happens is the third molars, Now with evolution, I see so many patients who by birth don't have a third molar. Now what the unlucky people who have it, including me, had to get it extracted. Now the reason is the gum over there, if it does not erupt automatically by the age of 24, 25, it kind of creates problem as you grow older. It gets impacted into the bone over here, and then it causes frequent infections. So you'll have to simply take antibiotics every time there is an infection, and it causes a lot of inconvenience. And secondly, whenever you have stress, you'll have wisdom tooth pain. So already you're in stress, and then you have toothache. That is unnecessary, more stress. So why do you want to go through all that? All you have, like, you can just easily go and get it removed. So if you are above the age of 25 and your tooth have not erupted properly, it's better that you get it removed. One more problem, which is very you know uh, important to talk about, is when it is coming slant like this, what happens is the food gets collected. If this is your previous tooth, the food gets collected in between over here, and this leads to decay of this tooth as well. So it is affecting your second molars as well. So we don't want to lose our second molars, right? They are very important for you to chew. So that is why most of the dentists advise you to get it removed by the age of at least 25. Yeah.
Okay. There's one more question which says, I have a slit on my tongue. Is that normal?
You have a
Slit on my tongue.
Slit on your tongue. Now, I need to see that first thing. And secondly, is it causing you any problem? Third is, since you like, did you have that since the beginning, or is it something that you have now? So there's a lot of history with this question. So you can get in touch with me on my Instagram, I guess. Then I can help you personally with the problem.
Okay. Okay. So, okay. Anybody who has more questions or anything, you can surely get in touch with Dr. Huma. And yes, Dr. Huma, as you said, that you can send me the link and everything so that I can share it with the team. With my
Yeah, sure.
Prachi, sorry, Dr. Huma was trying to show her that oracure thing in between.
Yeah. Let me show it to you. One
Okay,
second.
thank you. Sorry, Prachi, for interruption.
No, it's okay, sir.
Okay.
Yeah, this is the OC200. So it has a bottle over here which fills about 250 ml of water, and this is a water jet. So you can use that in between your teeth. And there's one more which is like for the entire family, which is OC300. Now this comes with 4 tips, and it has quite a big jar as well. So yeah, that is convenient as well.
Thank you very much, doctor. Actually, I tried this flossing, but this it's painful in the sense it is a lot of exercise there. So instead of that, I wanted to you, and that is why I asked the question. And I'm happy that you are also using it. So it means it is convenient.
It is. Actually, even I switched from, I don't want to name the brands now, but yeah, I tried 2 or 3, and then this was the most convenient for me. This has like 3 to 4 options. So the stronger jet, if that is painful, you can switch to a milder one.
And how much approximately does it cost? Very roughly.
I think it costs about, just a second. Yeah, it costs 3,000, but I think I'll send you the link for which you will get a 10% discount.
Prachi, will you please share the link with me? Prakash from Indore. Okay.
Sure.
Okay. Prakash from Indore. Okay.
Yes, sir. I've noted the name.
Okay. Thank you, Huma madam, very much.
No problem, sir.
Ma'am, your session was so nice. We are still getting questions. It is like home remedies for night grinding. Applying Vaseline on all your joints helps.
Okay. Now, petroleum jelly is not for internal use. It's for external use. So I would not suggest that applying that internally. And home remedies, it's good for something like cold, because there is no medicine for cold. You'll have it for 7 days no matter what. But for something like night grinding, it's because of the muscles. Now Vaseline is no way helping the muscles, and you cannot
तुम्हारी
apply
क्लास
it on
लगी है ना? वैसे क्लास चल रही है अभी, ये इधर है, इधर है, इधर है.
Yeah, so no, you cannot. Vaseline is not going to help you. To be very direct, no.
Okay. A question Mr. Gopal Anand has asked: alum for mouthwash is recommended or not?
I do not recommend it because I have not personally used it and I have no knowledge of Ayurveda. So if you are into using it, please consult an Ayurvedic professional, ask him, and make sure you're consulting an Ayurvedic doctor, not just a random person. But as far as I am concerned, no, I do not recommend it.
Okay. Okay. Do we have any more questions?
The last one from my side. What we should eat more? I am 68-year-old. For eyes and teeth, both to keep healthy. What should I eat more in my food?
Okay. So if you have healthy teeth and if you're lucky to eat fruits and vegetables raw, I highly recommend that. Now, when I say fruits, yes, if you're diabetic, then I do not suggest you taking fruits like which are high in calories, like sugar, sorry, like mango and all of that. So whatever your diet restrictions are, considering that, if you're including more of a raw diet, that would be something which is very ideal to keep your gums strong and healthy, and also your teeth. Make sure that you take the right amount of calcium. Now calcium, if you don't want to take it from milk, you can take it from flax seeds. So there are a lot of alternatives. If you cannot eat a particular thing, make sure that you're getting that particular nutrient from something else.
Okay. Do we have to do any exercises, or are there any movements or activities included for a healthy jaw or teeth or anything like that?
No, but yes, overall exercise is very good for your gums and teeth. Now, when you do yoga or when you do any normal cardio exercise, that is very much recommended to keep your systemic and oral health in place. But nothing like exercise for your jaw. And I've seen a lot of people now, they practice this jaw exercises like no, I do not recommend that because that causes a lot of stress on your temporomandibular joint. So facial exercises is not something that I recommend, but overall exercise definitely helps both oral health and the systemic health.
As we grow old, we should soak everything. Chana, mungfali, badam, everything should be soaked and then eaten. Are you saying that?
What I'm saying is when you have dentures or if you have a prosthesis, which is, when you take a nut and crack it with a prosthesis, what happens is there's an impact force. Okay, so like our jaw, it can exert about 720 kgs of force. So if it is exerting a force on one single point, that is when the prosthesis or the denture tends to crack or fail. So what I meant to say is when you are having any prosthesis that you have to take care of, make sure that you soak it and eat.
Thank you very much.
Yeah, no problem.
Okay. So thank you for such an informative session, Dr. Huma. It was very nice to have you with all our Khyaal members, and I hope they enjoyed too.
I hope they did. I had a very good time, and it was very interactive in the end, which was a pleasure talking to you all. It made me really happy. And if you ever have any questions, just directly send it to me, and I'll be very happy to get in touch with you all.
Sure. If anybody of any of our Khyaal family has any of the questions regarding any dental issues, please do send it to us, and we'll make sure we get it answered from Dr. Huma Javeriya. Also,